Hello everyone, this is PD 350, Chapter 1, the classification of motor skills. There is no video of me in the bottom right for today, just my voice. So Chapter 1 is titled the classification of motor skills. What I will do is run through this lecture and talk to you about all the content in here, and then at the end of this lecture I will refer you to a couple of readings and assignments that have been posted on Blackboard for you to complete connected to this lecture. So the purpose or the main concept here is to understand that when we talk about motor skills, that we can classify them or categorize them into certain groups that share the same features that allow us to understand these skills and prepare our learners to learn these skills. So as we go through this course, I think you'll find it useful to draw general conclusions that you can apply to a broad range of motor skills in a certain category, and that these general conclusions will help you develop a plan and teaching strategies, whether it's a patient in a therapeutic situation or a student in a classroom or an athlete on a field. It will help you draw general conclusions to apply to certain motor skills based on the categories or the classifications that that motor skill has been placed in. So here is my outline of Lecture 1. You can see that we're talking about generally what is a motor skill. We'll define that. Then we'll look at one-dimensional classification systems and two-dimensional classification systems that are pretty common in the research. You'll find these in most motor learning or motor control textbooks. Within the one-dimensional classification systems, we'll talk about categories that look at the size of musculature required to perform the skills. We'll look at another classification system that specifies where actions begin and end, another one that looks at the environmental context, and then another one-dimensional classification system that looks at the relative importance of cognitive and motor elements. And then at the end of this lecture we'll discuss a motor learning researcher called Gentile, who came up with a different way to classify motor skills that's a bit more complex, and it involves looking at two dimensions and being able to place a skill in one of 16 categories. So we'll take a little look at that at the end of this lecture, and then I'll challenge you to come up with some motor skills that fit into each of these classification systems. So when we talk about motor skills, they can be defined in lots of different ways. I like these simple definitions or simple things to think about. A motor skill has a goal to achieve. The skill is being performed for a reason. It's being performed voluntarily, and the opposite of that is a reflex, which is involuntary. So motor skills are being performed voluntarily. Motor skills require head, body, and or limb movements. So there is some physical observable movement taking place with the motor skill. And motor skills need to be learned or relearned. And the concept of relearned is important to those of you who are thinking about physical therapy, because we know that physical therapists aren't necessarily teaching people how to learn skills, they're teaching people how to relearn skills, whether it's riding, walking, or any other type of motor skill. Skills that need to be learned are probably more applicable to those of you who are interested in teaching children, and we're talking there about basic motor skills such as throwing, catching, all the way up to complex motor skills that involve combinations of different movements. Sometimes we might ask ourselves, what's the point in this? Why do we need to classify or categorize skills? And as I stated at the start of this lecture, by classifying skills into different categories, it allows us to make these general conclusions to a broad range of motor skills rather than making many specific statements about many motor skills. A good analogy to think about is the classification system in biology that allows us to put different animals into different categories. So by doing this, we can, if we're able to categorize a skill into one of the classification systems that we're going to discuss, then we can take the recommendations on how to teach those skills and apply it to our situation. The book says that skills in each of these categories follow common principles of instruction that instructors and therapists can readily apply to different situations. And they provide an example of a wheelchair in a crowded hallway and hitting a pitch baseball. So we have two motor skills here. One's from a therapeutic situation where you might be helping teach a patient how to use a wheelchair in a crowded hallway, and then hitting a pitch baseball, which might be a coaching or teaching application. Now you might initially look at these two motor skills, and they are motor skills according to our definition on the previous slide, and you might say, well, they have nothing in common. There's nothing that we can generalize to the teaching of both of these motor skills. However, both skills have one characteristic in common that could influence how they are learned and performed. People in both of these examples, in the wheelchair and hitting the pitch baseball, have to perform the skills in what we call an open environment, and you'll see that term in our next few slides. This means that to perform the skill well or successfully, the patient or the athlete must adapt to certain aspects of their movement to the changing characteristics in the environment. For the wheelchair skill, this means that the person must be able to move through the hallway, and there might be people who are walking in various directions and speeds that the patient has to deal with. And for hitting the baseball, the changing environment, and that's the key here when we're talking about an open skill, the changing environment involves the ball itself moving towards the person. Both of these skills, to be successful, we need to adapt quickly and accurately to changing conditions, and when we view them in terms of this open environment, we can see that these two seemingly different skills are actually quite related. So by putting both of these two skills into the same classification system, we could take some generalizations applied to that system and put it to both of these skills. So as we look at our one-dimensional classification systems, these allow us to identify characteristics that are similar to those of other skills. The one-dimension classification systems are best thought of as a continuum with two ends. For example, the book provides us the analogy of hot versus cold, and that we could take a body of water, feel the temperature of that water, and then classify it as either hot or cold, although more than likely it's probably going to be somewhere in between the two. The four most common one-dimensional classification systems are listed on this slide. What we will do is take a couple of slides on each of these classification systems and talk about them and provide some examples, and then the assignment at the end of the course will ask you to come up with your own examples for each of these. And in the assignment, I would ask you to not repeat the ones that we've used in the lecture or in the textbook, but to really try to think of your own. So the first classification system is the size of the muscles required for the movement. This is broken down into gross versus fine motor skills, and you can see that at the bottom of the slide here. This is pretty self-explanatory. The types of movements that require large muscles are what we call gross movements, and then the type of motor skills that require smaller muscular movements are known as fine motor skills. We know that skills like walking and hopping do not require the same muscle groups and the same size as those used for things like playing the piano or eating with chopsticks. Gross motor skills, people use large muscle groups, and then fine motor skills, as we said, focuses on small muscle groups. Some examples of fine motor skills might be handwriting, typing, drawing, sewing, and other things where there's a lot of hand-eye coordination involved. An interesting way to think about this is to consider physical therapy versus occupational therapy, and these two areas actually use this classification system quite a lot. For example, physical therapists typically work with patients who need to work on gross motor skills, walking, etc., whereas occupational therapists typically work with patients working on learning or relearning fine motor skills. In education, the use of the gross versus fine distinction is pretty popular for things such as designing curriculum and tests, especially in areas such as special education or adapted physical education. The second classification system asks where, when we take a motor skill, if we can see exactly where the skill begins and ends. And this is broken down into discrete, serial, and continuous. These are the three types of skill within this classification system. If a skill requires a specified beginning and end location, we call this a discrete motor skill. Examples could include pressing the clutch in a car, flipping the light switch, hitting a piano key, something where you can see the exact beginning and end of a movement. It's well defined and easy to see. A serial skill is a series or sequence of discrete movements. So it's a bunch of discrete skills put together, such as shifting gears in a car or playing a whole piece on a piano. Whereas pressing one key on the piano is a discrete skill, putting several of those together is an example of a serial skill. Continuous skills are easier to define and they're easy to see. These are skills that don't have well-defined beginning and ends and tend to be repetitive. So you might think as running, swimming, riding a bike. It's the same thing over and over, where we can't necessarily see where skills begin and end. So here's some examples. Some more examples. Discrete skills where we see the distinct beginning and end. Throwing a dart, we can see where it starts, where it finishes. Catching a ball, and when a patient goes from sitting to standing. Serial skills might be examples where we link several discrete skills together. A gymnastics routine. Continuous skills, steering a car, swimming, ice skating. I challenge you to think about hammering a nail, where that would fit within this, and brushing teeth. Maybe a trick question. A once-off hammering of a nail, if you just hit it once, would be a discrete skill. However, if you hammered the nail over and over and over, that would move towards a continuous skill. The same with brushing the teeth. The third classification system, using a one dimension, is termed the stability of the environmental context, and this is an important concept that we'll see when we get into Gentile's two classification system as well. This breaks skills down into open versus closed skills, and actually this comes from industrial settings. This is based on the system, on the stability of the environmental context in which the skill was performed. So with this, we're thinking about the environment that the skill is being performed in and what's going on in that environment. Is it changing? Is it moving? Or is it consistent? And is it stable? The three features within this classification system include the supporting surface on which the person performs a skill, objects involved in performing the skill, and other people involved in the situation. For example, in closed skills, this is where we're talking about when the supporting surface or the object or other people involved in the performance of the skill are stationary. There's nothing going on in the environment, it's very predictable, and the person performing the skill doesn't have to adapt to anything going on. As opposed to open skills, which are performed in an environment that's unpredictable, things are moving. Those things might be the supporting surface, the objects, or other people, but it's unpredictable and things are moving. And to perform an open skill successfully, the performer must act according to the movement of that supporting surface, the object, and other people. So as you can see here, performing an open skill requires greater expertise and practice than performing a closed skill. And that can be important when we get to designing activities and curriculum for either our patients or our learners, students, when we think about creating appropriate progressions. Some skills can be classified as open or closed. One good example is walking. When walking occurs in a hallway and there's no objects or other people in the hallway, we would consider this a closed skill. Walking would also be a closed skill if there are objects or other people in the hallway but they were stationary. However, if the objects or the other people were in motion, then walking would become an open skill where someone has to adjust to the movements of those other people. The same kind of thing for the motor skill of hitting a ball. Hitting a ball from a tee would be considered a closed skill because nothing's moving, there's nothing going on, whereas hitting a pitch ball is an open skill because that ball is coming at you and you have to adjust to the changing environment. The open-closed classification system is very popular and well used in instructional methodology, and it's becoming increasingly popular in rehabilitation contexts as therapists use it to plan activities and progressions for their patients. So here's some examples. Again, we talk about closed skills. It's a predictable environment. Gymnastics, typing, cutting vegetables. Open skills, unpredictable environment, playing soccer, wrestling, or my favorite example, chasing a rabbit. As you can picture in your mind, chasing a rabbit across a field, you don't know where that rabbit's going, where it's twisting, where it's turning, and that's an open skill. And then some skills would fall in the middle of this continuum. Finally, we can classify skills by the relative importance of motor and cognitive elements of those skills. And we can break these down into two main categories. One is motor skills, the other being cognitive skills. And as you can see on this slide, we could take some skills. I'm not sure what this move is here, but I might suggest to you that that's more of a motor skill, where the physical part of that skill is more important than the thinking part of that skill. Whereas other skills, such as this guy up here, is probably elements of both. So a motor skill, as opposed to a more cognitive skill, the primary determinant of success is the quality of the movement that the performer produces, and it's more the physical part of that movement is the most important thing, as opposed to a cognitive skill where the primary determinant of success is the quality of the person's decisions as opposed to the physical movement. And here you can see a game of chess. Actually moving the chess pieces is considered a motor skill, but the cognitive element is more important than the physical element of that skill. In reality, most skills require some cognitive elements and some physical elements. To break those two down, motor skills, decision making is minimized, motor control, or the physical part of the skill, is maximized. A cognitive skill at the other end of the continuum for this classification, a cognitive skill, the decision making is maximized and the motor control element is minimized. And here's some more examples. High jumping, weightlifting, changing a flat tire. Okay, although I might argue that changing a flat tire has quite a large cognitive element to it as well. Cognitive skills, playing chess, cooking a meal, coaching a sport. All motor skills that might require more of a cognitive element to it, with decision making maximized as opposed to motor skills. And if we're talking sports, we can sometimes think about within specific sports and skills that would fall at each end of that continuum. So as we move past those one-dimensional classification systems, there's been some criticisms of them. One problem with the one-dimensional classification systems is that it doesn't always capture the complexity of many skills that we must take into account when we're making decisions about instruction, routines, curriculum, feedback, and therapy progressions. So to overcome this, Gentile in 2000 built on the one classification systems and created her own. And it's become very popular in therapeutic textbooks and in teaching methodology textbooks, and that's why we see it in most motor learning textbooks. But it does come from a physical therapy background, and it provides a guide for establishing practice and training routines. It is a little bit tricky to conceptually understand, and I'll introduce you to the main characteristics of this taxonomy and provide you some examples in each of the categories, but you'll have to take a close look at it, read about it to really grasp what Gentile was proposing. So this is how Gentile's taxonomy is broken down. She came up with two main areas, or two general characteristics. She termed them the environmental context in which the person performs a skill, over here, and the function of the action characterizing skill. She then subdivided those two categories to create a taxonomy of 16 skill categories. And you can see this on the handout I sent you, or in the chapter on page 14, I believe. But you can see that she broke environmental context down into two areas, function of the action into two areas, and then further split those. So like I said, the two general characteristics are the environment and looking at the action itself. And then she subdivided these into 16 categories. She originally developed this taxonomy to help physical therapists, to help them with their patients and selecting appropriate activities for those patients. However, since then, it's been applied to other contexts, such as the teaching of physical education and helping teachers plan appropriate progressions for helping learners learn motor skills, and also for coaches who want to develop coaching situations that challenge their athletes to perform at a higher level. So the first dimension is the environmental context. And she broke this down into two characteristics. The first one she termed regulatory conditions. The term regulatory conditions refers to features of the environmental context to which movements must conform if they are to achieve the action goal. So this is pretty similar to what we talked about earlier versus open and closed, but it's looking at what's going on in the environment and how the person has to adjust to that. Gentile, in this part of her taxonomy for differentiating motor skills, looked at whether the regulatory conditions were stationary or in motion. Like I said, we saw this before in the open versus closed concept. And then the intertrial variability aspect of the environmental context looked at whether the regulatory conditions during performance are the same or different from one attempt to perform the skill to another. So looking at the consistency of the context or the environment, and is it always the same? Or as a person practices one attempt at the skill, is that the same as when they practice the next attempt of that certain skill? And then for intertrial variability, we either say it's present or not present. Yes, it's the same every time they perform the skill, or no, it's different as they perform the skill from one attempt to another. The second dimension in Gentile's taxonomy is known as the function of the action. With the function of the action, we can determine the function of the action by deciding whether or not performing the skill involves moving the body from one location to another, and whether or not the skill involves holding or using an object. So we're looking at the skill itself and making a decision on whether the body is moving, yes or no, whether it's stable or in transport, and then does the action or the skill involved in an object or no object being present. So we can answer yes or no to each of those for any skill that we look at. So Gentile came up with this taxonomy that looks at the interactions of those four environmental characteristics that we just discussed: stationary, motion, present, not present for intertrial variability, and then the four action function characteristics, which was body stability, stable, not stable, and then either there's an object involved or there's not an object involved. And then when you put those into a table format, it allows us to come up with 16 skill categories that we can place any motor skill into. And as we move through these last few slides, I would encourage you to think, what's the purpose of this and how you could use it in your future profession. This is scanned out of the textbook chapter I gave you, and I know that's not a very readable copy. That's why I provided the handout in Blackboard as well. But you can see here, and this is where it gets just a little bit complex. You can see that down here in the vertical column we have the environmental context, and up here with the action function with body stability and body transport, and that creates these 16 skill categories. Now, Gentile said that each skill category poses different demands on the performer in terms of the characteristics and number of variables that the performer needs to control and pay attention to in order to achieve the goal. She said that skills that demand the least of the performer are the simplest, and these are in the top left of this table, and then that skills that demand the most and are the most complex can be seen in the bottom right category of this table. So you can see, if we look at the top left, a motor skill in box 1A, there would be stationary regulatory conditions suggesting a closed environment, and no intertrial variability, meaning that each time the skill is practiced it's the same environment situation going on, and that there's no object involved and the body is not in movement. So you can see here that an example might be standing alone in a room or practicing a basketball free-throw shot without a ball. And then as we move diagonally to the bottom right, 4D is the most complex category according to Gentile. Here there's in motion regulatory conditions, so it's an open environment. There is intertrial variability, which means it's different each time the person is performing the skill, and that there is an object involved and the body might be in transport. So here an example would be walking in a crowded mall carrying a baby. So there's an object, the baby. It involves the body movement, walking in an environment that's changing, or practicing several soccer plays with a ball and defenders. So I would encourage you to take a few minutes to look through this taxonomy, look at the 16 categories, look at the different action functions, look at the different environmental contexts, look at the examples, and to see how it goes from simple to complex as you move from top left down to bottom right. This is from a different textbook and something that I scanned in. It's the same thing. It's dealing with Gentile's taxonomy, providing it a little bit differently. Again, we've got the 16 categories, and this also provides some additional examples of skills that would fall into each of those categories. This is also from another textbook and is a little application activity. So you can see, for a motor skill of putting a golf ball, the author of this textbook tells us that the environment is stationary, the hole's not moving, the floor's not moving, that regulatory conditions, that we have a changing variability, meaning that the putt might be taking place in different situations, the body is not in transport, and that there is an object present. And according to this author, that falls into category number 6, which would be right here. And then we can try to figure the rest of these out ourselves. Propelling a wheelchair through a crowd of people at a concert. Well, I would say that the environment is probably in motion. I would say that the regulatory conditions, each time the person performs that skill, it's probably going to be changing or different. That the body is moving different locations. And you could argue that the wheelchair itself is an object. So there's lots of practical uses of Gentile's taxonomy. One from physical therapy is provided on this slide. So maybe you want to evaluate the static and dynamic standing capabilities of your patient, and then use the taxonomy to create or evaluate their capabilities by progressing across the top row of categories. And I think this is actually from the textbook, so page 21 suggests that if we look at category 1A, can they stand without assistance? That's category 1A. Let's go back to that as we talk about it. Okay, so you got your patient who may have posture limitations, maybe as a result of a neurological problem or orthopedic problem, and you're evaluating them. So you can use the taxonomy to do that. So starting in category 1A, you have them stand without assistance. Can they do it? How well can they do it? Document it. Then can they stand without assistance while holding a book? That's category 1B. The next progression, can they walk without assistance a specified distance in an uncluttered walkway? 1C. And then finally, can they walk without assistance a specified distance in an uncluttered walkway while holding a book, which is obviously more difficult than 1C. So by going from 1A, 1B, 1C, 1D, that allows us to evaluate the balance capabilities of this patient that's come to you with neurological or orthopedic problems. So there's the slide just walking you through that progression. For those of you who are interested in teaching, Gentile's taxonomy can be used to create teaching progressions. We call these extensions and challenges, and to assess motor performance. For example, we might use Gentile's taxonomy to evaluate a student's ball catching capabilities. For example, we might see, can they catch a ball thrown from the same distance at the same speed for several trials, or can they catch a ball thrown from various distances at the same speed for several trials. Also, for physical education or coaching, we can use Gentile's taxonomy to help us develop a progression or a practice sequence when the ultimate goal is to help your learner or athlete hit a baseball thrown by a pitcher. Now, if we're starting working with young children or unskilled older people, we probably don't want to just jump in by throwing baseballs at them and hoping they hit it. We need to come up with a progression that helps them move towards being able to hit a baseball thrown by a pitcher. And this is where understanding open and closed skills is important, because we probably want to start with a closed skill version of the ultimate goal and move towards helping them learn it in an open situation. For example, in this situation where we're helping a learner hit a baseball thrown at them, we might start off our progression by having them bat a ball off a batting tee at the same height on each practice attempt. And here our regulatory conditions are stationary and we have an absence of intertrial variability. They're doing the same thing each time and the ball's not moving. That fits into Gentile's taxonomy. And then we can progress along the taxonomy. Next, we might keep the ball on the tee. However, we may have some intertrial variability present by moving the tee at different heights. Progressing to where we have a machine, a pitcher machine, which sends the ball with the speed and accuracy of each pitch being constant. And in this situation, the regulatory conditions are now in motion. However, there's still no variability because it's coming at the same speed and height each time. Progressing to finally, and you can probably imagine what's coming next, where we put the pitcher in a live game and they have pitches coming to them at different speeds, locations on each practice attempt, which was the goal skill that we wanted to help this person learn. So that's using Gentile's taxonomy and the different aspects of the environment and the function of the skill, and manipulating those categories to create a progression to help someone learn a motor skill. So the taxonomy can help us do a few things. First of all, it can provide as a useful guide for evaluating movement capabilities and limitations, and we talked about the patient with the balance situation. It can help us develop a progression of functionally appropriate activities to help someone learn a skill. And finally, it can help us chart the individual progress of patients and students as they work to obtain specific goals. And as you know, and I'm sure you're learning about in all of your classes, the importance of assessment and keeping records of learning or improvement is very important now, as we have to document that for either insurance companies for therapy or for education agencies to document learning. So to wrap things up, this was where we started with the chapter, to try and understand what motor skills are, and then to look at some different one-dimensional classification systems, and to look at Gentile's classification system. So I want you to look at the chapter, look at the handout, go back through this lecture a couple of times, and then complete the assignment that I've posted onto Blackboard that wants you to classify different skills as either closed or open or cognitive or motor or fine or gross. And then the second part of that asks you to come up with some skills that fit in Gentile's categories. I would like you to email that to me through Blackboard or UNCW email by Monday 3 p.m. So Monday 3 p.m. is the deadline to do that. Monday afternoon I will be placing another lecture onto Blackboard looking at Chapter 2. As I've stated before, if you have any questions, contact me and we will go from there. Thank you, and this is the end of Chapter 1.